Hello, my name is Dr. Rooney, and I'm a clinical psychologist in Bournemouth. I'd like to share with you some mindfulness recordings, but before we start, I'd like to introduce something about mindfulness. Mindfulness came over to the West through Jon Kabat-Zinn in the late 1970s, and previous to that, it was an Eastern tradition. So when we think about mindfulness, we often think about clearing your mind, Buddhist meditation, and it might feel quite religious. But the Western interpretation, it isn't meditation, it's mindfulness. And so it's thinking about not clearing the mind, because we can't do that. The mind is built for thinking, but instead to learn to listen to those thoughts. And rather than hooking into them and engaging with them, it's about not allowing them to, spiral and to start to hurt us. It's about being present and in the moment. There are two key parts to mindfulness. So the first part is about being present in the here and now. Sometimes people talk about when we think about the past, we might look at regrets, we might feel depression. And when we look at the future, we might feel anxious, all the what ifs. Mindfulness is about being right here, right now. Because right here, right now, I'm warm enough, I'm comfortable, I'm safe, I'm okay. And so it's about training the brain to be right here. And the other part is about being non-judgmental or even compassionate. If we can practice not being judgmental towards our thoughts, towards ourselves, towards our bodies, it can help us to start to be more self-compassionate, and it has a knock-on impact over all of our mental health. So the present moment is the only thing that's real. So when we think about the past, it's often a story, and it might be, a memory might be a story that we've been told, or it might be an unhelpful way of remembering it. It might be biased. And when we think about the future, that's not real. All these what ifs, they might never happen. The only thing that's actually real is our senses, right here, right now. So touch, taste, smell, hearing and vision. They're the only things that are real. And so mindfulness is about bringing ourselves back to our senses, to the right here and right now. There's lots of evidence that it's really helpful in mental health. So studies have shown that it's been really useful in depression and in anxiety. It reduces rumination. It can be helpful for OCD. I think I use it in most presentations that I work with. And it's often the core now of third wave therapies. So if you've heard of acceptance and commitment therapy, mindfulness-based CBT, dialectic behavioural therapy, DBT, a lot of them have got mindfulness as part of their core. It's really beneficial. Brain scan studies have shown there's an area of the brain that increases the more we do mindfulness. So it does have an impact on us as well, neurobiologically. But we have to practice it. Like working any muscle down the gym, we need to keep on working our mindfulness muscle for it to improve and become more natural. So often people will say to me when they first start, I can't really do it, I can't concentrate for very long. That's okay. That's normal. Well done for trying. And it's about slowly increasing the time that we're doing it until it feels more natural. When we're doing our mindfulness, we're putting ourselves into a state of mindfulness. So that is doing our meditations, maybe lying down, sitting down, closing our eyes, putting ourselves deliberately into that state. And the hope is that the more we do that, the more it becomes a trait, a personality trait, that we are just a more mindful person. So for example, if I'm being a more mindful person, if it's a trait, then when I come to something that might feel a bit challenging or where I might be a bit self-critical, for example, if I go home and I haven't done the washing up, I might look at it and go, oh, Lauren, you've not done the washing up. And then I might spiral, and you've not cleaned the toilets, and you've not changed the bed, and we get into that place of ruminating, beating ourselves up, blaming ourselves. If I'm being mindful, I'm just looking at my senses right here, right now. Let's just turn on the hot water. That feels quite nice to put my hands in. Let's just smell those bubbles. Let's look at that little rainbow on the bubbles. And so I'm being more in a trait of mindfulness. So when we talk about doing mindfulness, we think about both doing the meditations that you're going to hear today, but also trying to do some activities mindfully, like have a shower, do the washing up, anything you do day to day, and just try to bring your senses into it. But regularly, need to practice, need to do our exercise. So my top tips would be to plan it into your day, and then try to pop it in at different times to experiment. So you might be someone who prefers to do it at bedtime, or you might fall asleep when you do it. You might be someone who prefers to do a 5-minute one at lunchtime when you're feeling overwhelmed, or maybe one in the morning. Experiment with it. See which time suits you. Equally, see which type of meditation suits you. There are so many different types. The ones we're going to present today are quite basic. We've got our ones that soothe the body, our ones that soothe the mind, and our ones that are more almost escapism, a safe place, going somewhere else. And that can be a bit of distraction. So I wouldn't recommend doing only those escapism ones. I'd recommend trying a range of them and then seeing which ones suit your brain the best. So when you're ready, we're going to begin some of our mindfulness practices, and we've got 10 today that we're going to look at.